What are common cosmetic jaw surgeries? There are basically three types of jaw surgeries. One, correction of the upper jaw, we call it as maxilla. Someone has got a very protrusive upper jaw. When they smile, the gums are visible, the teeth are proclaimed, we call it as upper jaw discrepancies. That excess of upper jaw can be corrected. Someone who has got flattened face or the nose tip is down, there is called as deficiency of the upper jaw. So those patients, when they smile, the teeth are not visible. They look old age than the appearance of the normal age. This we call it as deficient maxilla or upper jaw. Next, the lower jaw. Someone has got a very protrusive lower jaw. The jaw is placed forwardly. So that we call it as excessive lower jaw. Opposite of it, someone who has got a very short lower jaw. When they smile, the lower jaw is bulky and there's a puckering over the chin. We call it as retrusive lower jaw. The third variety is the deficiency of the chin. Someone has got a very short chin or a very prominent chin. These are the three areas the cosmetic jaw surgeries can be corrected. 1 at the upper jaw, 2 at the lower jaw, 3 at the chin. Now, how to identify this? Whether you have a problem with the upper jaw, whether you have the problem with the lower jaw, whether you have the problem with the chin. Always consult a maxillofacial surgeon who is trained in orthognathic surgery. They will run through a series of x-rays, tests, clinical examination, then pinpointly diagnose which is the jaw which is disproportionate. So if you correct that particular jaw, problem is solved to a larger extent. If you find this information very valuable, kindly share with the people who are in need of it.